Did you know that if you have high blood pressure during your pregnancy, the placenta doesn't get enough blood and the baby might receive less oxygen? I'm Dr. Carolina Melgar from Sonam Health. I'm a practicing cardiologist and I work every day with pregnant patients that are struggling with health problems that affect their babies. So having high blood pressure during pregnancy needs close monitoring. I want to tell you about potential risks and how to take care of yourself and your baby. Did you know that high blood pressure can begin before your pregnancy? It can also develop during your pregnancy. Actually, there are 4 types of high blood pressure during your pregnancy. Number 1, in chronic hypertension, high blood pressure develops either before your pregnancy or during the first 20 weeks of your pregnancy. It might be hard to know exactly when it began because high blood pressure usually doesn't have any symptoms. Chronic hypertension with superimposed preeclampsia is number 2. It happens when we have a patient with chronic hypertension and she increases her blood pressure readings during the pregnancy. This condition can have proteins in the urine and kidney failure. Number 3, patients with gestational hypertension have high blood pressure after 20 weeks of pregnancy. There's no excess of proteins in the urine and no other signs of organ damage. But in some cases, it can eventually lead to preeclampsia. In this situation, high blood pressure starts after 20 weeks of pregnancy. And in this situation, you might experience severe headaches, dizziness, blurred vision, sometimes temporary loss of vision, shortness of breath caused by fluid in the lungs, nausea, vomiting, and swelling in your face and hands. This usually goes along with a sudden weight gain. Now, if we don't treat it, it can lead to serious or even fatal complications for the mom and the baby. One of the most serious complications is, for example, eclampsia. That's when seizures take place. It can start off with confusion, disorientation, and blurred vision. So let's circle back to high blood pressure during pregnancy. What's the risk? First of all, there's less blood flow to the placenta. And if the placenta doesn't get enough blood, the baby doesn't receive enough oxygen and nutrients. This means he's not going to grow. He's not going to develop like he should be. This can cause the baby to be born prematurely or with a low birth weight. A baby that is born prematurely, or also called preterm babies, means that they're born before 34 weeks. And babies that are born early can have breathing problems, heart problems, eye problems, and an increased risk of infection. Another complication for high blood pressure during pregnancy is placental abruption. So this is when the placenta separates from the inner wall of the uterus before the birth is supposed to happen. High blood pressure and preeclampsia are the 2 conditions that increase the risk of placental abruption. Imagine your baby is separating from the only thing that gives him the oxygen and the nutrients that he needs. This can cause heavy bleeding, and it can be life-threatening for you and your baby. Another thing that can happen when you have high blood pressure during your pregnancy is a growth restriction. This means your baby can't grow and can't develop like he should be. It happens because the placenta arteries that carries the oxygenated blood to the baby are narrowed because of this high blood pressure. I've mentioned also that one of the complications of having high blood pressure is a preterm baby. I've mentioned that one of the complications of having high blood pressure is a preterm baby. This means he's born before than he should be. It's very dangerous because his lungs are not fully developed. He can have difficulty controlling his temperature and unstable vital signs. So what we do is we have him stay in an incubator to help him control his temperature and keep him monitored. So up till now, I've mentioned the risks and complications that high blood pressure can affect the baby. Now, what about the mom? Studies show that if you had preeclampsia more than once, you have a higher risk for cardiovascular disease. This risk is also higher if you had a premature birth due to high blood pressure. Many of my patients ask me, how will I know if I develop high blood pressure during pregnancy? Monitoring your blood pressure is a very important part of your prenatal care. You want to have a pressure below 120/80. That's your ideal blood pressure. During your pregnancy, your pressure should never be over 130/85. If you have higher readings in 2 or more occasions, your doctor will probably prescribe medication to control your blood pressure. If you already have chronic hypertension, you're probably familiarized with these numbers. High blood pressure tends to get worse unless we control it. Remember that besides high blood pressure, you can experience symptoms like severe headaches, blurred vision, temporary loss of vision. You can see bright lights or being sensitive to lights, upper stomach pain, especially under the ribs or on the right side, nausea, vomiting, dizziness, shortness of breath, sudden weight gain, and swelling, particularly in face and hands. If you experience these symptoms, tell your doctor as soon as possible. He'll probably run some tests to detect extra proteins in your urine or other signs of kidney problems, low platelets in blood, and signs of liver damage. Now, one of the last things I want to cover is a question I get asked a lot. Is it safe to take blood pressure medication during pregnancy? There are some medications that are safe to use during pregnancy. However, they're very few and very specific. So never take your chances and self-medicate because most of the drugs that are usually used to treat hypertension can harm the baby. Your doctor will tell you if you need treatment, and I'm sure he'll prescribe the safest medication. Remember, take the medication exactly as prescribed. Don't stop taking it, and don't change the dose on your own. Many drugs have adverse effects if you stop taking them at once. Your doctor may also recommend low-dose aspirin. This is to prevent artery damage in your placenta, so your baby receives all the oxygenated blood he needs. So tell me, have you had hypertension during pregnancy? Let me know in the comments below. I'll be happy to answer any questions. Thank you for watching.